Hello and welcome to the Malaria Notebook with me, Liliana Dayo. In today's discussion, we'll be talking about quality of care for malaria control. Welcome. So, why is quality of care critical for malaria control? Quality malaria services saves lives, protects medicines, and accelerates a malaria-free future. Also because quality of care ensures accurate diagnosis and correct treatment. It also ensures that there's reduction in severe illness and malaria deaths. It does prevent misuse of antimalarial medicines and drug resistance. It also leads to improvement in patient trust and care-seeking behavior. It does also strengthen surveillance and data for decision-making and also enhances efficiency of malaria programs and resource allocation. What are some of the quality of care components? Quality of care is actually the extent to which health services are safe, effective, timely, people-centered, equitable, and efficient in improving health outcomes. And for this context, about malaria services. It's about quality diagnosis. It could be through the rapid diagnostic tests, microscopy, and other new technologies that are available for confirming malaria. It's about ensuring that the treatments prescribed are effective and also prevention services. It could be for vector control, chemo prevention are available. It's also about ensuring that commodities are available through effective supply chains and also community engagement, where the community people have the ability to demand for services whenever they're required. It's also about surveillance such that we are able to tell whether the interventions that have been applied are working or not. So, what are some of the common quality of care gaps we experience in our health facilities and community? One of them is delayed diagnosis and inadequate malaria testing before treatment. The delayed diagnosis could be as a result of postponing of hospital visits by the patient or the caregiver, or sometimes when they get to the health facility, they find long queues and have to wait a little longer. It's about incorrect treatment practices and poor adherence to malaria guidelines. For instance, you find a patient with uncomplicated malaria receiving treatment for severe malaria. And with regards to the patient, you find that after a few doses of the malaria treatment, they stop taking treatment because they do not have, they feel like the symptoms are over and probably have recovered. Another gap is frequent stockouts of malaria medicines, diagnostics and essential supplies, and also with regards to human resource, where you find that the clinicians or generally the health provider have inadequate training to be able to provide quality services, irregular mentorship and support supervision for the health providers. Another gap that we experience is weak laboratory systems, irregular surveillance, poor documentation, and lack of data use for decision making. Also, poor referral systems. For instance, you may find in a health facility where the referral is taking place, there's only one healthcare worker, and for some reason, cannot close the hospital to escort the referred patient to the next hospital, or sometimes there are unavailable transport mechanisms to be able to transport the patient to the next health facility. It's also about delayed care-seeking behavior, where, as mentioned earlier, you find the decision makers at the household or community level postpone the time of going to hospital for health services. Another gap also we experience is limited access to quality malaria services, especially in remote and underserved areas in many African setups. So about data quality and continuous improvement, these are essential for us to ensure they're working so that we're able to get effective, responsive, and patient-centered malaria services. What it does is that it does improve accuracy of malaria data for decision-making and also supports early detection of malaria trends, outbreaks, and hotspots. It also enhances monitoring of diagnosis, malaria trends, treatment, and patient outcomes. It also helps in identifying service delivery gaps and supports instant or immediate corrective actions. It does also strengthen forecasting, quantification, and supply management, and this helps in reducing instances of malaria commodity stockouts at the health facility level. It also does promote continuous quality improvement, accountability, and generally malaria elimination efforts. So this table is a summary of a few African countries with regards to the quality models that they are applying in the health service during the implementation of health services. And for instance, in Kenya, we do have the Kenya Quality Model for Health, whose focus is mostly on continuous quality improvement, patient standards, and safety. In Uganda, we have the Quality Improvement Framework and Strategic Plan, whose focus is mostly on the patient and also health service accountability. And then we also have star rating assessment in Tanzania, performance-based financing in Rwanda, national healthcare quality strategy in Ghana, whose focus is mostly on the patient, safety and equitable care. We have Nigeria's national quality strategy and safe care, whose focus is on facility accreditation and quality improvement. Malawi with quality management directorate policy, and whose focus is on standards and continuous improvement. Across most African countries, we have some common components for quality of care models, and the focus is mostly on continuous quality improvement, patient-centered care, supportive supervision and mentorship, data quality and performance monitoring, health worker capacity strengthening, and community engagement and accountability. So what's the future of quality malaria care? The future of malaria care strongly depends on working systems, and this includes also innovation, quality services, and people-centered care. It's about also strengthening digital health, surveillance and data systems, and also expanding high-quality diagnosis and laboratory services to the lowest level of healthcare. It's also about promoting patient-centered and community-based malaria care, and also enhancing continuous quality improvement and supportive supervision, especially amongst the healthcare workers. It's also about improving supply chains to ensure that we have consistent availability of malaria commodities, whether it's in the hospital or at the community level, and also leveraging innovation, technology, and skilled healthcare workers to support malaria elimination. Thank you for listening. Let's keep learning. Let's subscribe for more lessons from the Malaria Notebook. Let's fight malaria one lesson at a time.